I'm Sheena and I'm from Raleigh.
So Sheena, when you very first came in here, what was your major complaint?
Pretty much my entire quality of life was completely interrupted by pain, constant pain, and living on pills.
And that had been going on for how long?
Since mid-October of 2012.
Good golly. So we're talking, what, 6 months?
6 months straight.
Yeah. And you had pain in your back.
In my back, my lower back, into the glute, the both sides of the glutes, and into my ankles.
Wow. And shooting pain down your leg?
Exactly.
Right.
And I couldn't sleep. I couldn't find a comfortable position. I would shower and get heat on my back, and I would sleep on heating pads, and just had a lot of pills I would have to take to get through the normal workday, etc. And it was just getting to a point where I was really depressed about it.
And didn't you tell me you had to sit on a stool
Yep.
to do the dishes?
I had the chore stool. Yeah. I sat on a stool and I loaded my dishwasher, then I'd move my stool to the oven and I would cook, and then I'd move my stool back to the sink and I would pack my lunches, and it was really bad.
The chore stool.
The chore stool, we
That's
called
pretty
it.
pathetic.
hmm
And you're young.
I was 31 when the chore stool was initiated into the kitchen.
Oh, good
Yeah.
golly. And now the chore stool's gone.
We retired it 2 weeks ago.
Yeah, and now you're sleeping through the
I
night?
sleep through the night. Well, the issue, as you know, I had purchased a very expensive bed for my back, and then I couldn't sleep in it, and we were concerned I would have to figure out how to sell this bed, but now I'm sleeping completely every single night through the night. I've probably slept 3 weeks straight without waking up at all.
Crazy.
Yeah.
Oh,
No couch, no recliner, no pills.
So it sort of sounds like you might recommend spinal decompression to others.
Absolutely. I am singing the praises of it to everyone, because when you go through the medical system, I went and I saw a back specialist, and they kind of don't have any options except for injections, surgery. They kind of have this very gloom and doom attitude about it. No one ever suggested to me this might work. I had to actually research this for hours and hours to find that it existed and that I could possibly pursue it. And so that's my new goal in life, is to let people know that they don't have to have injections, and that as long as they get on the right path and they see, specialists like yourself, that they don't need all of these other avenues that are recommended. Now, I want to go back to the back doctor I saw and be like, oh yeah, you remember that whole surgery, MRI, you need this and this and this, and sorry for you. I want to go back so bad and be like, look at this. It's just like lift a car, throw it at them. So I really don't think people understand that this is out there. And so a lot of people now are believers because of me. And I don't think enough people know about it. They don't. So, yes, that is a recommendation. I'm very excited to have my life back.
So now you don't need the handicap sticker in the car.
I have to give it back. My friends are making me give it back. So my handy tag has to go back at the end of 4 months.